Alright, let's chat again with Chapter 5. I was kind of hoping Marcy would take this one, but looks like you're stuck with me. It is going to be a fairly quick lecture, because to be quite honest with you, this is just all memorization. And it's pertinent in the world of EMS, especially with your documentation, to use some of the medical terminology and then just to understand everything moving forward through the book. It all kind of is based on this segment of the text where it explains how to understand words, what they mean, and how you break them down. So it's pertinent from that aspect as well. So we'll dive right into it. This would be a good chapter when I, put out that first message talking about kind of some good study habits. Get yourself some 4x6 index cards. Throw all this stuff. Throw the word on the front. Throw the meaning on the back, and just memorize. Basically, read the book. Do what you have to do to study so that you can memorize this information. It's going to be anything you do in the medical field is going to utilize this. A few of you guys are going into healthcare and you're college students, so it's going to be pertinent for everything that you do moving forward as well. So it's something that if you can learn it here, you don't have to worry about it later. So it'll be just medical terminology, just kind of the definitions of that. And then we'll break down the difference between anatomy and physiology, and then you'll learn the anatomic terms, which is really the best way to describe everything in your assessment of the patient. So a couple quick slides here on the components of the medical terms, and this kind of will roll you back to really probably basic English in high school. Everything's the same as far as how words are made. It's just being introduced into the kind of the medical side of things with this chapter and explaining how all of it works with that. So compounds, basically, it's a compound, so it's two or more words. So smallpox, anything where you can separate out the two words into individual words, that's going to be what the compound is. And then we'll have roots, prefixes, and suffixes. So roots are the main part of the word. So therm, basically when you combine that with thermometer, meter meaning measuring, therm meaning heat, so you're measuring the heat of something. So it's not something that you probably think about when you say thermometer, but if you break it down, that's kind of how the two words separate out. And then you have prefixes, which are going to be at the beginning of the word, suffixes, which are going to be at the end of the word, and basically you'll take some of those roots and you'll change the prefix, and then they'll mean the opposite. So bradycardia, brady meaning slow, cardia meaning the heart, so slow heartbeat, versus tachycardia, tach meaning fast, cardia same thing, so fast heartbeat. So that kind of gives you a little example of how prefixes work, and then suffixes are at the end. So arthritis, hemophiliac, so you take the itis off, the iac off, and then you can understand what the definition of those words are. And then here's just an example of a word and its actual breakdown. So cardiologist. So when you think of cardio, think of when you're working out. What are you doing? You're working the heart. So a cardio workout is a workout of the heart. When you add cardiology to it, now you add the study of the heart. So if you just say cardiology, it's the study of the heart. But then you can add another segment to the end of it with ist, meaning one who specializes in it. So cardiologist is the heart, the study of, and the person that specializes in it. So you can do that with all the different fields, kind of break them down, and understand kind of how those different segments work within the word. Okay, onward to acronym. So an acronym is an abbreviation made up of initials that can be pronounced as a word. And this is going to be actually a really important one to understand in the EMS world, because you can basically base all of your assessment off of different acronyms. So they use the word CPAP, and so that's a breathing apparatus. I'm sure you've heard of it where people use it to sleep. We use it in the ambulance for when they're having certain breathing disorders to kind of pump their body full of more oxygen and push it in there. But CPAP is the word, and then when you break down the letters, continuous positive airway pressure. So when we get into some of the assessment components here in a couple weeks, you're going to see words like sample, and that is a breakdown of everything that you would ask the patient to basically get their history. And it's going to be very important. It's going to be some memorization with it, but it's something that once you learn it, you have it. It's the same for basic. It's the same for paramedic. It's going to be the same if you're a nurse. It's going to be the same, basically anywhere where you're in the healthcare field when it comes to that. So acronyms are something that are very important. You're going to see them all throughout the entire textbook. And here they're just going to kind of dissect a compound word. So cholecystitis, if you break it down, chole meaning bile, and bile, when you think of that, it's going to be coming from the gallbladder. Cyst is just a closed sac. So when you add it to a compound word, it can have its own meaning, but then, people also have just cysts that they develop in their body. Ovarian cysts in women are very common. It's very painful. You'll see them in the ambulance. So it just depends on how the word is used and what context it's used in to get the actual meaning. And then itis meaning inflammation. So when you combine the word cholecystitis, it's a bile sac inflammation, so it's an inflammation of the gallbladder. When you think of other words that you can break down, think of bronchitis. It's going to be an inflammation of the lungs. You've probably heard plenty of examples. You've probably been diagnosed with plenty of these things throughout your life, and now you should be able to put two and two together and create kind of a new meaning for what they actually are. Okay, here's an important one for EMS providers, and that's to understand when to use medical terms and when you shouldn't use medical terms. Probably the big one is don't get all technical when you're speaking to the patients or the family. You have medical training. The vast majority of people that you take are not going to have medical training. Therefore, when you talk to them, you have to talk to them in kind of common terms. So, instead of saying, are you having dyspnea, which means are you having shortness of breath, you would just simply say, are you short of breath? Are you having problems breathing? Are you having difficulty breathing? Keep it simple for them so that they can get you all the information you need through the assessment process. Sometimes those complex words, they're confusing, even amongst trained healthcare providers. So basically in the world of EMS, if you can keep it simple, keep it simple. If you're documenting, then that is a good time to dive into some of these explanations, so that way when it goes to court or it's pulled for whatever reason, it's easily explained to the professionals that would be dissecting whatever paperwork that you're sending. Now with that, you also need to remember you better make sure that you use this stuff properly when you're putting it in documentation, because if you misuse words and you end up going to court for whatever reason, they're going to tear you apart and they're going to make you look really dumb, and it's just not going to be good for you. So understand the terminology. If you're not for sure what something means, use common terms, but when you're documenting, try to use all of the technical terms, just because it does make for cleaner paperwork. It's kind of like you used to always see on all the shows and everything, they use the 10 codes when they're talking. So 1050 meant car accident, 104 meant okay. That's kind of the universal one that everybody knows. But it was confusing because if you didn't know all 110 codes, you might not know what they're talking about. So in the last 10 or 12 years, even through all of the emergency services, they've really kind of gotten away from the 10 codes and really gone to simple terms. So kind of use that mindset with this. It's okay to use simple terms, but understand all the technical jargon that goes with it. All right, now just a quick slide here diving into the difference between anatomy and physiology. And some of you, especially you college kids right now that are up getting ready to enter the healthcare world, you'll probably have an entire semester class that's going to really dive in deep to what anatomy and physiology is. And it's very intense. It's going to be a tough class. You're going to have to study a lot. You're going to have to do a lot of memorizing. But basically, when you think of anatomy and physiology, anatomy is the study of the body structure. So this subject is going to help you describe particular organs, the organ systems, including the position and their locations. And then when you think of physiology, it's the study of the body function. So this subject is going to describe the actions of the organs and what the different organ systems kind of do. So it's going to be helpful guides to decision making through your EMS experience, as an EMT, to understand what organs fall where on the body. So that's going to be part of the anatomy. So then you can use that, not that we really diagnose in the field, but you can use that to create some differential diagnosis of, okay, if it's upper right abdominal pain, these are the organs that are located there. So from a physiological standpoint, this is what the condition could be, and this is how I should treat it. So it is pertinent. We'll have a chapter on it coming up here, and Marcy will be covering that since she has a lot more education from that aspect than I do. But we're going to cover basically in one chapter what some of you guys will cover in an entire semester at college. So you'll just have to hold tight for that, and it'll break down everything for you there. All right, now on to directional terms. There's going to be a number of slides here. And again, this is good for describing all the aspects of the body. So when you're given a report, you can use these directional terms to hopefully help the person on the other end understand. They should understand it, being a nurse. And then also when you're documenting, it is good to use all of this terminology just to paint a very clear picture of everything. But it is very important to understand everything. So however you want to study this, create a picture with the body and draw out all the different planes and all the different terms on there so that you can study it. Again, it's memorizing basically, so it's whatever you have to do to help yourself memorize this. But when you think of the anatomical position, if you stand up, okay, face forward, put your hands down to your side with your palms facing forward, that's going to be the anatomic position that you're going to see through the book. That's how they do all the slices on the body. That's how they explain everything. Remember, right and left is always by the patient's right and left, not how you're looking at them. So you're looking at them thinking that's their left, but it goes off of the anatomic position. So it's actually based off of the patient's side. You divide that body into different planes. So if you slice the body down the middle to create two side by side, so a left and a right side, that's going to be your sagittal or median planes. And then if you slice the body in two halves, so the front half versus the back half, that's going to be your frontal and coronal planes. And then if you slice the body in half, top and bottom, that's going to create your transverse and horizontal planes. Now when you look at the midline of the body, that's cutting the body right down the center. And medial refers to the position closer to the midline. Lateral is going to be further away from the midline. So a couple of you guys that are looking at going into physical therapy, that should kind of put a little bit perspective into things like when you see an MCL injury, which is the medial collateral ligament, medial meaning closer to the midline, that's going to kind of explain where that ligament is when you're doing your assessment and everything. So just kind of puts a little perspective to where you would use some of this information. Okay, now to break down one side versus both sides. So bilateral, bi meaning two, that would be both sides. So if you were in a car accident and you had bilateral femur fractures, that means you're going to have breaks on both femurs. Unilateral is just one side or the other, and then you define it with left or right. Now the mid-axillary line is going to extend basically from your armpit to your ankle, and it divides your body into a front and a back half. Now when you try to divide front and back, it's anterior or ventral, and then posterior or dorsal. And when you think of ventral versus dorsal, think of like a dorsal fin on a dolphin. It's on their back, so that's the posterior versus the ventral, which would be the front. And you will use anterior, posterior. Actually, we'll use it next week in CPR, because on infants, when the pads are too big to put both on the front part of their body, you're going to do what's called anterior posterior. So you're going to put one on the front, one on the back. That's probably the easiest way I can explain that. And then when you're trying to divide the vertical from above and below, it's superior and inferior. And think of like superior, like I'm the king, I'm the superior one, I'm on top of the world, versus being the inferior person and kind of below everybody. So superior above, inferior below. A few more here. Proximal, distal. These are actually ones commonly used when describing injuries to the extremities of the body. So proximal is going to be closer to the torso. Distal is going to be further away from the torso. So if somebody has a femur fracture and it's a proximal femur fracture, it's going to be broke on the upper half of the femur, which is going to be closer to the torso, if that makes sense. And then palmar and plantar are kind of easy ones, because you see these in common real world, where palm meaning the palm of your hand, and then plantar meaning the sole of your foot. So somebody that has plantar fasciitis, that's an injury to the sole of their foot, is probably the easiest way I can explain that. Here's just a quick visual on the very basics of the different segments of the body. So understand that thorax is the chest region. So I'm sure you've heard of people that have had pneumothorax and they've had to have tubes put in their chest. So pneumo is going to be the lung, and thorax is going to be the chest. So that kind of describes that. Abdomen we're going to get into in a minute here, because it gets broke up into its own different categories. So understand there's a head, a torso, and a lower extremity, and then the upper extremity, and then there's segments within that. So just kind of, again, memorize this and understand it for assessment purposes, for documentation purposes. And then here's a good image that all of those terms that we just talked about kind of puts a picture to all of those definitions to help you understand. So again, this is something you could probably draw this out on paper with just some blank lines, go back in, fill them in so that you can understand them and memorize them. I can't explain enough that this is just memorizing at its best right here, but it's pertinent to know because you will use it through documentation, through your assessment, through your handoff reports. You'll use them in a number of ways. Another term that's commonly used is the midclavicular line, and that is going to be your clavicles, which are your collarbones, right? Upper chest. So think of how we broke apart the words earlier, mid meaning middle, clavicular meaning clavicle or collarbone, and then line. So it's the middle of the collarbone line, and it's going to divide that chest into two different regions. And then here's a good visual of the planes, and when you slice those in the three different directions that we talked about. Honestly, this would have been a good slide to have right after that slide that kind of explained everything. But this is an image of the three different slices with the planes that your body will be in. All right, a couple slides on the abdomen here, and they are important because you'll have a lot of patients with abdominal problems. And it's not that it changes your treatment a whole lot, but it allows you to understand a little bit more of what might be going on with the patient. So basically, you take the navel, the belly button, and then you run a vertical slice and a horizontal slice. You're going to divide that into 4 different quadrants, and it's, again, as the patient is in the anatomic position. So right upper quadrant is going to be the patient's right side above the belly button. Left upper quadrant, same thing on the left side, right lower quadrant, and then left lower quadrant. and then we'll get into the next slide here, which kind of breaks down where the organs fall. So there's a lot going on here, and it's probably a little bit challenging to see this to a certain degree. But basically, this is going to show you where everything in your abdomen falls within those quadrants. So, when you think of a number of people have probably had appendicitis, where you have to have your appendix removed. If they have upper left quadrant pain when you're assessing them, you can pretty much rule out that it's not an appendix issue, because that's going to be in the lower right quadrant. So basically, just take a couple minutes here. Look at all the different organs. Understand that some of them do spill from quadrant to quadrant. So the liver actually is in both upper quadrants. Your intestines are really going to hit all quadrants. So it could be just about anywhere if you're having an issue like gastroenteritis, which is just an inflammation of the intestines. But you could see pain just about anywhere with that. Again, it's not going to change your treatment a whole lot for the most part, especially at the basic level. But it does let you kind of paint a little bit better picture of what could be going on with the patient too. And kind of last topic of the chapter here are the positional terms, and these will also be pertinent for you, because depending on certain conditions, you'll want to position the patient in a specific positional term. So supine, lay down on the floor, you're laying flat on your back. That's going to be the supine position. Prone position, you're going to be laying face down on the floor, fully extended out, but face down, lying on your abdomen. And then recovery position is going to be laying on your side. And we do prefer to put unconscious non-trauma patients in this position, mainly because then if they have an episode of emesis, it's not going to just drop right back in them to where they can aspirate it and get it into their lungs, which will create all kinds of different problems. So that's why it's a preferred position for unconscious non-trauma patients. Obviously, trauma patients are a little bit different. We'll go through many segments with those, but those you want to immobilize to prevent further injury. So here's your image of the patient in the supine position, just flat on their back, hands to their side. You've probably seen people like this. Now you just understand how you can describe it. When we're treating people, it's just going to depend on a number of variables, but you may want to place your patient in a supine position. More times than not, they're going to be semi-Fowlers, which we'll cover here in a second. But it could be a position of comfort for the patient. And again, it's just another way that you can explain it in your charting and in your assessment process, with how your patient was positioned. And then here's your visual image for the prone position, and understand that, you will learn it through the entire program, but when you find patients in these positions, there's going to be proper methods of getting them rolled over, especially if you suspect there could be trauma. So understand that prone position is face down, and then it'll make a lot more sense as we go through some of the chapters later in the book when we're talking about some of that. And then here's your lateral recumbent, also called the recovery position, and you can have left lateral recumbent or right lateral recumbent, and then there's kind of different reasons for putting people on one side or the other. Pregnancy, those women should be placed on a specific side to prevent pressure in certain areas of the body. We'll get through that with the OB section that I will not teach. That will definitely be a Marcy topic. But just understand lateral recumbent is the recovery position. You're going to be on your side. And then the last positional term here is the Fowler position. So Fowler is just seated straight up. It'll show you an image, I think, coming up, but imagine putting the patient on the cot, putting the back straight up, and the patient seated there. You've put them in the Fowler position. If you lean them back part way, so like halfway between supine and Fowler, then it's going to be the semi-Fowler position. Vast majority of our patients, and that's how they'll get put on the cot, is in the semi-Fowler. But like I said, there will be a lot of different times when you have to adjust that based on certain criteria. So if a patient has low blood pressure, You don't want them sitting upright because you're making it more work for that heart to push the blood up to the brain. So in that instance, you're actually going to want to lay them down, maybe even kick their feet up to get all that blood kind of naturally moving more towards the core, more towards the brain to sustain life a little bit better. So again, this chapter is just a lot of memorization, but there's a lot of pertinence to it as we get through the entire book. And then, like I said, here's your visual image of the patient on the actual cart, kind of sitting that halfway between supine and sitting straight up, which would be Fowler's. So this would be considered the semi-Fowler's position. And when you do your documentation, you want to document patient placed in semi-Fowler's position on cot. So back to the chapter review here. Scroll through it. Understand that this is just a lot of memorization. A lot of note-taking, create those flashcards, do whatever you have to do to understand this, because when you take that EMT basic national test and they're asking you scenario-based questions, they very well may have it all described using all of this anatomic position and all the terminology that's here. So if you don't have a basis of understanding what tachy means or what lateral means, and they put those words in the questions, it's going to make it tough for you to pass the test because you aren't going to understand exactly what they're trying to explain. And then when you look at the answers, none of them may be pertinent because you don't know the information from above. So again, memorization, it's one of those painful chapters that you have to do, that you have to know. Go through. If you have questions, by all means, throw them out there, either to the group or send me a message individually, and then we'll get through this. We got a few more chapters of kind of boredom here. The anatomy, physiology, lifespan stuff will be a little bit more interesting, but still it's just basically a lot of information that you have to learn and memorize. So we've got, I think, one more unit with that, and then we'll start getting into the nuts and bolts of everything with assessment, lifting and moving, and then we'll start getting into the actual medical conditions and breaking everything down. So that's it for this chapter. It was a short one, should only be maybe a 25-minute, 30-minute lecture, and then you're set to take Unit 2's quiz, and then I will send out directions for next week as far as CPR will be on Tuesday evening. For those that need it, if you have BLS CPR, you do not need to attend. If you do not have BLS CPR, then we'll need to get that taken care of. And then the other couple modules are exactly that. And they're going to be kind of self-study modules where you watch the video, take the quiz, and they're important because it's HIPAA and bloodborne pathogens. So take your time, do those, and we'll go from there. So have a good weekend, whenever we'll see or hear you again.